This is part 1 of a screencast from chapter 9 on articulations. In this screencast, we're going to define a joint. We're going to compare, we're going to classify these joints, and we're going to see as we go through the semester that there's different ways of classifying structures. And typically you can classify structures either the way they're made structurally or by what they do functionally. So we're going to look at both the structural and functional classification of joints. And we're going to look at the relationship between how mobile a joint is and how stable a joint is. So let's define a joint. That joint is a place where bones come together. And typically when we talk about an articulation, we're talking about multiple bones. But there are also articulations between bones and cartilage, and we also see that teeth are stuck down into bones. So those are all examples of articulations. The root that we're going to see is arthro. So arthrology is the study of joints. And again, we can classify them structurally or functionally. So let's look at the structural classification of joints. There are 3 structural classifications: fibrous, cartilaginous, and synovial. Fibrous joints are joints that are held together by dense connective tissue. Cartilaginous joints, just like it sounds, are held together by cartilage, and synovial joints are held together by a joint cavity that is made up of ligaments. Now, ligaments are also dense connective tissue, but the big difference is that there is a joint cavity in a synovial joint, whereas in a fibrous joint, there is no joint cavity. Those cavities are filled with fluid, and it is going to separate the surfaces of the articulating bones. We're going to have a separate screencast just for synovial joints. So let's look at functional classifications. When we classify joints functionally, we're talking about how movable are these joints. So if the joint is immobile, it cannot move, we call that a synarthrosis, or plural synarthroses. The adjective would be synarthrotic, right? So fibrous and cartilaginous joints can be synarthrotic. Amphiarthroses are joints that are slightly movable. So I think of amphi as meaning a little of one, a little of another, like amphibian, little on the land, a little in the water. So slightly movable is not quite immobile, but not quite completely mobile. It's kind of in between. Amphiarthroses can be, again, both fibrous or cartilaginous. And then diarthroses are freely movable joints, and these are our synovial joints. Now keep in mind, when we classify joints, they can fall into a structural class and a functional class. When we look at the range of motion of joints, we can see that some joints have no movement at all, such as a suture. And some have extensive movement, such as, think of your hip. You can swing your leg all the way anteriorly and all the way posteriorly. It's the structure of the joint that's going to determine how movable it is, its mobility, and also how stable it is. And what we're going to see is that there's a trade-off between how mobile and how stable a joint is. So when we look at, for example, the suture, a suture is an immobile joint. It's not movable, and it's very, very stable. Thankfully, we don't want the bones of our skull to be moving around. On the other end of the spectrum, we have a very movable joint, a mobile joint, the shoulder. The shoulder's freely movable. You can swing your arm around in many different directions, but there's a cost, and the cost is that it is much less stable joint. So the more movable, the less stable. And then in between, we see that we have varying degrees of stability and mobility. Here we've got the different structural classifications. So here's a fibrous joint, and we see that the primary function of the fibrous joint is to hold those two bones together in a way that's very stable. A cartilaginous joint is going to resist compression and tension. So it's going to absorb shock. It's going to have some resiliency. It's going to be slightly movable to immobile. But our synovial joints, these are the ones that we typically think of. These are our diarthrotic joints. These are the ones that when we say joint, we're typically think of, like your finger joints, your hands, your knee. And so their primary function is movement. So let's look at fibrous joints and cartilaginous joints here in this screencast, and then we'll dedicate a separate screencast to the synovial joints. So fibrous joints, again, are connected by dense, usually dense, regular connective tissue. And so that's going to be little tiny ligaments. There's no joint cavity. They're either immobile or slightly mobile. And we're going to look at three different kinds: gomphoses, sutures, and syndesmoses. So our gomphoses are the teeth. This is our only type of gomphosis. You can think of a tooth as a peg in a socket. And so the tooth is sitting in the socket inside the mandible or the maxilla, depending on whether it's a lower or upper tooth. And they're held in place by these little tiny ligaments that are called periodontal membranes. And so these are not movable typically, so they're synarthrotic. So again, think about this, guys. Look, there's two classifications here. We've got structural classification is gomphosis. Functional classification is synarthrosis. And you know this one, right? When your kids are losing their baby teeth and that tooth is like hanging out by a thread. What's the thread? What's holding it in there? It's those little periodontal membranes. And that's when the parent will attach a string to the tooth and, I don't know, connect it to the drone and have it take off. That's what they're breaking. That's how that's coming out of there. So that's a gomphosis. A suture we're more familiar with. This is found between bones of the skull. Again, super short little fibers in between those bones holding them together. Now, look at the edges of these bones. It's not a straight edge. They actually have these little finger-like projections, so that's going to increase the surface area, increase the number of little fibers that are there to hold those bones together. It's a very strong joint, and it's going to help decrease the risk of fracture. Again, functionally, this is synarthrotic. Structurally, it's a suture. And you know from the chapter on bone growth that this is intramembranous growth that allows these skull bones to the cranial bones to grow and then ultimately become ossified. And then the last of the fibrous joints is synemosis. These are, here's two bones, in this case the radius and the ulna, and they're held together by this sheet, which is made up of dense, regular connective tissue, but it's more of a membrane than individual little ligaments. And we can also see this between the tibia and the fibula. So in our forearm and in our lower leg. And this is going to allow some movement between these bones. So functionally, these are classified as amphiarthroses. And it allows this bone, the radius, to pivot. It allows these two to rotate around each other. So that's going to allow you to have like supination and pronation. Oh. All right, so that is our fibrous joints. Now let's look structurally at cartilaginous joints. Cartilaginous joints are going to use either hyaline or fibrocartilage to adhere the articulating bones together. Once again, there's no joint cavity, and once again, this joint is either going to be immovable or slightly movable, immobile or slightly mobile. And the two kinds are synchondrosis and symphysis. So our synchondrosis, look up here, C-H-O-N-D-R-O, chondro, is a root that means cartilage. So synchondrosis is going to be a cartilaginous joint. And here we have joints that are articulating with hyaline cartilage. Both of these that are illustrated here are classified as synarthroses. They're immobile. The epiphyseal plate is actually a joint. Look at this. It's cartilage in between two regions of bony tissue. And we don't typically think of this as two different bones, but it is holding together two regions of bone. So the epiphyseal plate is an example of a synchondrosis. And then also our costal cartilages that are attaching the ribs to the sternum. So these are called costochondral joints, hyaline cartilage. And this is going to give some flexibility. If you were to put your hands on your rib cage and take a deep breath in, can you feel your ribs? Your rib cage kind of moves out. So that is helped in part by the slightly movable joint of the costochondral joints. A symphysis uses fibrocartilage. So this is a pad of fibrocartilage. The pubic symphysis is in between the two pubic regions of the coxal bones. And this is going to act as a shock absorber and resist compression. We also see fibrocartilage around the rim of the intervertebral discs. And you can see how shock absorption is going to be very desirable between the vertebra bones. And this is also going to allow your spinal column to have some increased flexibility. So I'm going to stop there for this screencast, and we'll pick up the third type of structural classification in the next screencast. We'll talk about synovial joints.